Hello, everyone, and welcome back. It says that we are live and we are here today. I'm sorry for the mix up because, in my haste of getting this out, because I was like, we need to talk about this, I ended up putting the wrong date starting for the event that it was yesterday, when in actuality it is today. So I hope those of you who thought it was yesterday are actually tuning in on today. If not, I will send it out again so you can catch the replay. But I wanted to make sure that we got this information out to you. Those who are watching, be sure to drop it in. Let me know where you're watching from. You can tell me what the weather is like, kind of like whatever. We are a community here. There's no judgment. And we just want to know who is following along with us so that we can say hello. Dr. Bibb is joining us from Mississippi. And so I want to know what the weather looks like in Mississippi. What are you guys dealing with over there?
Well, it's actually pretty warm today. I think it's near 75,
Mm.
almost 80. It will, I think, get up to 80 this week. So actually a lot warmer than it has been over the last few days, few weeks.
Yeah, that is actually pretty warm for you guys for this time of year because I think we're gonna max out around, I think it said like 77, 80 for us
Really?
this week. So that's actually pretty good. And it's nice weather today. Like it's really beautiful today.
Yeah, it is here too. Definitely.
Well, I'm not going to hold us any longer because I again posted kind of the wrong thing and everybody's probably like all confused or whatever. But we're going to get into it and we're also going to make sure that people know what we are talking about because I know everybody is really interested in this topic. And we'll make sure that we get it out again so that people can see it. But guys, welcome again to Lessons Beyond the Stethoscope. And here we provide you with practical health tips and tools that you can use in your everyday life because we understand that life ultimately affects your health. This is episode 12, part 2, Harmful Consequences and Healthy Cures of Obesity. And today we have joining us again Dr. Kimberly Bibb, who is a board certified family medicine physician and an obesity medicine specialist. She's the assistant professor in the Department of Family Medicine at the University of Mississippi Medical Center, where she provides primary care services to children and adults of all ages. And she was also she played a very integral role in establishing the UMMC Weight Management Clinic, where she focuses on educating patients on the importance of developing healthy lifestyles and providing them with treatment for obesity and other chronic diseases. So, thank you again, Dr. Bibb, for joining us on today.
Well, thank you, Dr. Booth, for having me. It's such a pleasure to be here with you today. I certainly enjoy, as you mentioned, educating my patients, and it's always a pleasure to join you in discussions like this. So thank you again for having me, and I appreciate the work that you are doing as well.
Thank you. So, the CDC says that 2 in 3 people in the United States are considered either overweight or obese. 2 out of 3, 2/3. So that's like 60% at least are
Right.
considered overweight or obese. And this is something that is going to not only have some consequences with people's health, but it can also affect their finances. And because we've noticed that this is costing our healthcare system billions with a B of dollars because of the effects that this can have on your body. And before we get into that, because we're going to talk about like obesity and what it is, we're going to talk about diet and exercise and treatment and even going into bariatric surgery, all of those things. But before we get into that, how do people determine if they are overweight, obese? How do we get to that? Where does that come from? How do they know that information?
Right. Well, that's a very good question, Dr. Booth, in terms of defining exactly what it means by being overweight or obese. So, in general, one of the main tools that we use to define obesity and even being overweight is something called the body mass index, or the BMI. So the BMI, I'm sure most of us have heard of that, but it is really the most common and really the cheapest screening tool that we have to screen and assess patients in terms of their weight. Now, of course, there are some limitations that we have previously mentioned in terms of the BMI, such as muscle mass. So whether someone has an increased or decreased muscle mass, that may affect their BMI, or how to interpret the BMI. Also, there may be some differences as it relates to different races, and even as it relates to gender, there may be some differences there. But in general, the BMI is really the best tool that we have to assess patients in terms of their weight status and whether they are at a healthy weight or in the overweight or obese category. And to just give you an idea of what the BMI is and how it's calculated, it's basically taking a person's weight in kilograms and dividing that by the square of their height in meters. So the weight divided by their height in meters squared is how we calculate the BMI. But of course, I don't expect people to remember that. There are actually quick and easy calculators on the web, on the internet, where you can even put in your weight and your height. You can put in your weight in pounds and your height in inches, and it can calculate what your BMI is. So when we determine or try to decide whether someone is overweight or obese, we do have parameters that we use. So in terms of a normal BMI, that is considered a BMI of 18.5 to 24.9. And then overweight is considered a BMI of 25 to 29.9. And then when we get into the obese category, that's a BMI of 30 or greater. So those are just some ways, or that's really the best way that we use, especially in clinical practice, to assess patients in terms of their weight status. And then, of course, we know that at higher BMIs, then that is associated with various chronic conditions that we will discuss here shortly. But that is really the best way that we have right now to assess obesity and weight status for patients. Now, there are a few other tools that can be used, such as the waist circumference. That is another measurement that we can use to screen for obesity. And in general, in terms of talking about the waist circumference, that is generally defined as a waist circumference greater than 40 inches for men or greater than 35 inches for women. So actually, in my practice, we measure the waist circumference when patients come in addition to their other vital signs, to determine how well they are doing with their weight loss goals and looking at other parameters other than just the BMI. And then just one other tool that can be used is the body fat percentage, which can also be used to determine whether someone is obese or overweight. And just in general, an abnormal body fat percentage is considered to be abnormal for women if it's greater than or equal to 32%. And then for men, a body fat percentage of 25% or greater is considered abnormal. So those are some of the main parameters that can be used, or biometrics that can be used to assess obesity. But BMI is by far the most common tool that we use, especially in clinical practice and in everyday conversations when we're talking about weight and weight status.
Okay, I like the fact that you said there are all these multiple different ways that we can measure it, but people can have access to this in the privacy of their own homes. Because you and I both know when people come to the office, they are mumbling and grumbling when it's time to get on the scale. They don't want to do it, those sorts of things. And in the part one, we discussed the sensitivity of how to discuss obesity with our patients and approach it and things of that nature. But this is one of those things that, like you said, you can Google BMI calculator.
Right.
You can get on your scale, see how much you weigh, know how tall you are, and then put that in there and see for yourself, where am I?
Right.
Where am I? And then how do I go from there? So now that we know how to calculate the BMI, again, like we said, once you get to the point of overweight or obesity, we start to notice that clinically things change in your body, things start to happen, and there are some consequences with it. And I'm going to pull up your slide here to kind of talk about those different complications or consequences that we can have from obesity. Can you walk us through some of those?
Sure. And I just really like to just give a visual representation or an idea of some of the medical complications of obesity. And as we can see from this particular slide, obesity can affect pretty much every organ system in the body from head to toe. And so, as we can see, even starting from the top, there's something called idiopathic intracranial hypertension, or another name for that is pseudotumor cerebri. So that's one condition, and I see several patients on a weekly basis with that particular condition. But that can actually be associated or a complication of obesity. As we can see, it can also be associated with cataracts and even some of the leading causes of death in the U.S., including heart disease, diabetes, stroke, and as it mentions on the slide, even some types of cancers are associated with obesity as well. As we know, osteoarthritis, which affects a lot of different joints in the body, especially the knees, hips, and even back, can be a direct complication of obesity as well. We may have even heard of fatty liver disease or hepatic steatosis. That is a very common complication of obesity as well, and even some gallbladder complications. Also, obstructive sleep apnea, as we very well know, is a very consequence of obesity as well. Even for females, we see that infertility, even having abnormal periods, and even a condition called PCOS or polycystic ovarian syndrome can be a direct result of a person's weight and being obese as well. So as we can see, there are a lot of different complications and consequences. Health can be associated with obesity, and really more of a reason why we should have more discussions about this, and why we really should be treating more of the underlying cause of these conditions, which is obesity in and of itself. And so again, this just gives just a quick overview of some of those various medical complications that can be associated with obesity, that and some that we may not even think about a lot, but definitely can be associated with obesity.
And this visual is good because there are some things that are on here that people may not know about, like cataracts. It's like, oh, I didn't quite see that, and kind of make the connection with how that makes sense. But
Mhm.
because what makes the news a lot of times is heart disease, stroke, all of that. But it, like you said, can affect you from head to toe. And that's what I
Mhm.
want people to really grasp and understand, and just kind of take it in and look at this visual that you have, like all of these things. And this isn't the full list. These are just
Right.
a few of the common things that we see. But I want people to know, although I want you to see it and understand it, and realize how serious it is, because this is what we're talking about. It affects your health. Once you have all of these things, and there's medications and blah, 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 and all of that that comes into play. So that's when we get into the financial piece and realize how obesity affects you financially. But all is not lost, right?
Mhm. Right.
Because there are some things that people can do. And I want to talk about that, like the things that people can do. Because when we think about obesity, the other thing I want people to understand is that it is considered a disease. The
Mhm.
American Medical Association has called it and defined it as a disease, and not just something that happens because people make poor lifestyle choices. Now, we
Right.
need to understand that our lifestyle choices are important. We need to make sure we have the appropriate things in place, like diet and exercise and all of that. but know that it truly is a disease. So, what can people do in terms of diet? What is like an appropriate diet that people can follow? Do we have to be plant based and vegan and all of these things, or is there some other things that we can incorporate? And again, I'm not against vegan, I'm not against plant based. I just know that some people cannot follow it for one reason or the other.
Right.
But what is it that people can start to do in terms of diet to start making it make sense for them?
Right, right. Well, one of the first things I would like to say in terms of diet is not thinking of diet as being something that's temporary, because I think a lot of times people will say, I'm going on a diet, and they will just go on that particular diet for a short period of time. And then eventually, when they lose a certain amount of weight, they will revert back to their previous unhealthy eating habits. And so that's one of the first things I would like to recommend. It's just not thinking about it as being something temporary, but thinking about your diet as being what you eat on a daily basis, just being a more healthier way of eating in general, and then something that is sustainable for you throughout your life. And as you mentioned, some people may not have a preference to do vegan or preferences to do other particular things. So that is one of the things that we generally suggest when we are evaluating someone in terms of their dietary practices. So what are their preferences? We have to even look at what is the culture for this particular patient, and what are some of their just some of the things that they like to eat in general, and then just finding some healthier ways of doing or preparing some of those healthy or some of those dishes that they prefer to eat. So in general, I guess just in terms of losing weight, we want to generally try to decrease the number of calories someone is taking in, and then try to increase the number of calories they are burning, which will be the physical activity part that we'll discuss here shortly. But in general, we want to try to decrease and have a healthy amount of caloric intake. So for instance, for women in particular, a general calorie intake per day would be about 1,200 to 1,500 calories. Whereas for men, that would be about 1,500 to 1,800 calories per day. Now, again, this will vary depending on a person's energy requirement, how many calories, again, what they are doing in terms of their physical activity per day. But these are just some general parameters for caloric intake for men and for women. So that's one way that we can look at our diets in particular in terms of weight loss, because most of the time we will find that our diets are high in calories, high in fat, high in unhealthy carbs, and other things that can contribute to the weight. And so what we want to do is, again, try to just decrease the overall caloric intake to make sure we're within those parameters in general. And then some of the other things we can look at would be some of the evidence-based diets that would make sure we're getting the appropriate nutrition that we need. For instance, the Mediterranean diet, as we probably have heard, has been ranked as the number one overall diet for actually, I believe, the fifth straight year in a row. And the Mediterranean diet has actually been shown to have a lot of various health benefits. It actually can help improve overall mortality and reduce the risk of some of the chronic diseases that we have previously mentioned, such as heart disease, diabetes, and even certain cancers. But the Mediterranean diet is really not a diet per se, but it's more of a healthy eating plan, as I just mentioned. Now, it is one that is more plant-based, and it does focus on eating foods that are in their more natural state, foods that are rich in fiber, that are rich in, have more unsaturated fats versus saturated fats, foods that are higher in antioxidants, which are going to be some of those foods that help prevent illnesses such as respiratory illnesses, and even some of the cancers that we've mentioned. But the Mediterranean diet in general does include eating more fruits and vegetables, whole grains, beans, nuts and seeds, and even lean meats such as seafood and lean poultry, and then low-fat dairy products, and then limiting the amount of red meat and sweets that a person consumes. So the Mediterranean diet is just one of those evidence-based diets that we have. But again, there are some other ones such as the DASH diet, which is the dietary approach to stopping hypertension, which is very common that we use for treating or using in patients that have high blood pressure. But really, sometimes you can even combine some of these eating plans. And so you can take part of the DASH diet and part of the Mediterranean diet and just make it appropriate for that particular individual. But in general, again, we want to just focus on foods that are healthier. Again, more fruits and vegetables, more lean meats, less processed foods in general are better in terms of just having a healthy lifestyle in general. So those would be some of the things that I would recommend when considering looking at a diet per se or a healthier nutrition plan. Another thing I do recommend that would be really ideal, if possible, is to even consult with a nutritionist or a dietitian to really help develop an individualized nutritional plan that the patient can follow on a regular basis. Because again, there are a lot of different factors that have to be taken into account when we are developing a good nutrition plan for patients. And I know it's so much out there, and sometimes people really get confused on what to do and what to look at, and even reading food labels is really important as well. And a lot of times people don't really understand how to read food labels. And so if you can find some classes where you can attend and get some of that education around improving your nutrition as it relates to reading food labels and learning what the different macronutrients are and how to just eat healthy in general and decrease the amount of calories in general. I think that's really important. I think, again, too, when we look at our calories, look at some of those hidden calories where we may not even realize we're consuming a lot of calories in certain things, like, for instance, sodas. So what are you drinking? What is in the beverage that you're drinking? How many calories are in that Coke or that Pepsi or that sweet tea? So sometimes we think if we switch from drinking sodas and switch to sweet tea or lemonade, we're doing good, or switch to juice, we're doing good. But we have to think about the amount of sugar and the amount of carbohydrates, unhealthy carbs that are in those beverages that can be very unhealthy for us. And so those are, I guess, some of the main things that I would suggest in considering, taking into consideration when we are looking at our diet or our way of eating, what our diet consists of, if we would like to look at it like that, for instance.
You brought up some things that I feel like I may not want to do, Dr. Bibb. No, you mentioned no, you mentioned the juice, because
Uh-huh.
you're right. A lot of people say, well, juice is healthy. But then when you look at that juice, is it really healthy? Because is it a processed juice, or is it a, like, just something that you strained? And
Right.
what it sounds to me like, a lot of what you're saying too is just like you said with the Mediterranean, a lot of it is in its natural state. So you can look
Mhm.
at it and say, oh, this is lettuce. This is
Right.
supposed to be lettuce. This is still lettuce. So you can
Mhm.
look at these things and tell that it is what it is. And I think that's the take home point, is if you're eating certain things, that it looks healthy, it makes sense. I know one of the things that get people too are like salads. I've had some people say, well, I'm eating a salad. And I say, okay. But then I
Yeah.
ask them about the dressing. And
Dressing.
that's
Right.
what gets people in trouble, is the dressing. And so it's like, you could have had a huge hamburger with
Mhm.
fries and stuff, because of not only the type of dressing that you're putting on there, but how
Right.
much you're putting
Right.
on there.
Right.
So you're right when you say people have to read the labels, know what that's saying,
Mhm.
getting something that makes sense to you. I think that's what always works for the long term with a lot of
Mhm.
people. For myself, I'm like, I can do this for a little bit, because I've had quite a few patients start something and then they kind of fizzle out with it because they're like, I'm tired of this,
Mhm.
because it's not something true to what they do.
Right.
So to just drive home that point, a lifestyle change. So again, don't look at it as a diet. Look at it as a lifestyle change. What is something that I can realistically keep up with? And a good point that you said is getting someone on board might help, like a nutritionist. Okay, this is what I
Mhm.
typically eat. What is something that I can eat similar to this so I don't miss that? And so I don't go back and like binge eat it or whatever.
Mhm. Right.
So that's excellent.
Yes, and another point I will make in terms of that is so we can be more aware of what we're eating and being more mindful. One of the things that I suggest is keeping a food journal. That will be a
Mhm.
very good way to track what you're eating. You can even track your calories, and then you can look back and see exactly what you're eating on a daily basis, and then you can make adjustments from there. One of the tools that I do generally recommend, and they have, of course, a lot of different apps that are available, but one in particular that many people may have heard of is called MyFitnessPal. But you can
Mm.
track your food intake and even track your physical activity in the MyFitnessPal app. And so that's just one tool that can be used, but there are various others that are available that can be used as well. And if you don't use an app or don't want to use an app, you can just do it the old fashioned way and just write it down. But again, paying attention to those calories, and like you mentioned, even hidden calories in dressings and other condiments can be very important as well. So,
I love that. I'm gonna have to link that one, because I tell people it's like you have to write it down or put it down. So being
yes,
intentional is always key. But
right.
even if, and I like the pencil and paper, but then some people get a little sketchy on me with that one. It's
Uh-huh,
like, oh
uh-huh,
well, I left it at home, so I guess I
right.
don't have to write it down. So the other one, if you're not an app person and you don't want to download the app, you have a little notepad, probably little that little notepad on your phone, and you can
Right.
start taking notes on there and say, okay, I had this, and put everything down, even that little piece of
Hmm.
candy, that
Right.
gum, whatever, because those small little calories tend to start adding up, and you're like, oh, I didn't even know that.
Right.
So now let's pivot a little bit and talk about exercise, because diet is great. Diet
Yes.
is one of the things that you can start to see some changes. But then when you add exercise on top of it, you can really start to see some things. And we know that it was the new year recently. We're just getting into it. And everybody started going to the gym. Everybody said, I'm going to sign up for the gym. I'm going to go. And probably some people have fizzled out by now. And there's like, oh, I don't want to do that anymore. And people think I have to go to the gym. I have to do lift weights. I have to do CrossFit. Maybe I'll walk. Like there are all of these different options that people have for exercise. So talk to us about that. Like where can we see some of the results? What can we start to do to get into an exercise routine?
Right, right. Well, in terms of exercise, I will just like to first start off with just going over what the recommended guidelines are for exercise for everyone in general. And so the recommended amount of exercise is 150 minutes a week of moderate intensity exercise, or 75 minutes a week of vigorous intensity exercise, or you can have an equivalent mix of moderate and vigorous intensity exercise on 2 or more days a week. So that plus 2 or more days of muscle strengthening exercises. And that is where we're doing training to work those major muscle groups. But let's kind of step back and just talk a little bit about moderate intensity exercise, because people may wonder, like, exactly what is moderate intensity exercise? So, moderate intensity is basically exercise where you should be able to talk while you're doing that particular exercise, but not be able to sing the words of your favorite song. So that just kind of gives you an idea of moderate intensity exercise. And then vigorous intensity would be more intense, of course, but that's where you're breathing harder and faster, and you're having trouble talking in complete sentences with vigorous intensity exercise. And so then you may ask, so what are some examples of moderate intensity exercise? So moderate intensity would be maybe when you're walking at a brisk or fast pace, maybe even doing water aerobics, even riding a bike on level ground, even pushing a lawnmower can be classified as moderate intensity exercise. So that just gives you a few examples of moderate intensity. And then I know, Dr. Booth, you mentioned CrossFit, and then I think sometimes we hear about HIIT training, that high intensity impact training. That would be considered more of the vigorous intensity exercise. Even jogging or running would be considered vigorous intensity. Right, if you're riding a bike uphill versus on a level ground. So riding uphill, when you're having to work harder with that, that's more vigorous intensity exercise. So that just gives you some idea of moderate versus vigorous intensity. And as I mentioned, those are the guidelines that are in general for everyone. So everyone, not regardless of what your weight is, everyone in general should be meeting those guidelines. And what the research has shown is that most people are not meeting the recommended exercise guidelines. And so when I'm talking to patients about starting a weight management program, first of all, I will assess where the patient is currently. And that's actually another vital sign that we talked about. So when we're taking our vital signs in clinic, another thing that I like to do is assess their physical activity vital sign and to find out exactly what is their current level of physical activity and what are they able to do? What are some of the barriers to those exercises that we're recommending? So again, we have to really look at some of those things and then try to figure out again, make some good recommendations for patients. But in general, I do recommend that people find what they enjoy doing. So I don't want to tell you to go walk outside or run or get on a treadmill if that's not something you enjoy doing. But if you enjoy dancing, or there are a lot of various dance classes and even Zumba classes that people really enjoy doing. Some people may enjoy playing tennis or playing with their kids. And I do recommend making it a family event, making it a family affair where you can involve your kids in exercising as well, because we know that our kids are supposed to get at least an hour of physical activity a day as well. And so you can make it, again, a family affair by involving the whole family with exercise. But again, just finding something you enjoy doing, finding ways to work out at home, I think is really important too, especially as we have seen during the pandemic, where a lot of people, well, for one, that they initially, and people couldn't go to the gym anymore. And so, and then once they did reopen, I think we were still a little reluctant to go back, but try not to have that as a barrier and think about ways that we can exercise at home. For instance, YouTube has a lot of different exercise videos on YouTube, and there are even apps, as I mentioned before about the MyFitnessPal app. There are a lot of different exercise apps. One in particular that I like to use is called FitOn, FITON, and it has a lot of great exercises there. You can tailor it to exactly what you want to do. Also, I think it's good to just have like an exercise buddy. So somebody that can help keep you motivated, keep you on track, and maybe that can just help encourage you to exercise as well. Sometimes when we have a partner, that just helps us to be able to just keep us motivated in terms of exercising. Also, I think another thing to think about when it relates to exercise is just one, not getting too overwhelmed with the process and not feeling like you have to do all of it at one time. And so I know I mentioned doing 150 minutes of moderate intensity exercise a week. You can spread that out across the week in however many increments you prefer to do. And so if you prefer to do 10 minutes, or if you only have time to do 10 minutes at a time, you can break that up into 10-minute increments, or you may do 10 minutes here, 20 minutes there, but not feeling like you have to do all of your exercise in one particular block, but it can be divided into
Mm.
segments and increments across the week. And so the more we exercise across the week, the more days we exercise, the better. And if you can break it up like that, I think that's even better. Also, just scheduling some time on your schedule to exercise, I think is really important. To just thinking about it like another appointment or just something that you have to do
Mm.
on a daily basis to take care of yourself, such as, brushing your teeth and um, washing your clothes or cooking, whatever you need to do on a daily basis to take care of yourself. Think about exercise as being one of those things that's part of your daily routine.
These are all great points, Dr. Bibb. Like, I'm hearing accountability partner, because there are times when you don't want to get out of that bed, because if you're going to make space for it, sometimes it's probably before things happen or at the end of the day. So having someone that can say, hey, come on, we got to do it. Did you get your time in today? So accountability, being intentional, finding something that is fun, being able to involve others like your family, like, to make it make sense for your lifestyle. Those are all excellent points. So then when
Mhm.
people are marrying their diet and their exercise, what I notice is there comes a point of frustration though, because they say, I'm eating the things, I am doing the things, I'm exercising, I'm getting out there, but I am not seeing the results. The scale either isn't moving, or they just not seeing the things the way they want to see it. So what should people be focused on? Are they supposed to focus on that number and on the scale, or are there other things that they can kind of see, okay, these are some of the changes and it's okay to see that? But walk us through that part when people hit that plateau or hit the point of, I'm just not getting reaching my goals.
Right, right. Well, that's a very good question, and one that I encounter a lot with my patients. I do have a lot of times patients that will say that they weigh themselves every single day.
Mm.
And that is one thing that I do discourage, is not weighing yourself every day. If at the most, maybe weigh once a week, pick a day of the week where you can weigh yourself and just use that as the one day that you weigh. But in general, as you mentioned, not really just getting fixated on the scale, on the number that's on the scale, but looking at other parameters, other health measures that you can look at to assess your progress. And those things I think can be motivating in and of themselves. And so, for instance, as I mentioned before, the waist circumference, a lot of times we don't realize that
Mm.
when we start exercising, we can start losing fat, but we start building more muscle too. And muscle has weight as well. And so
Mhm.
you may not see much of a change on the scale, but then when you are looking at some of those other parameters, such as the waist circumference or the body fat percentage, then you will see that those numbers start to improve, even though the weight on the scale may not be changing a whole lot. And so those are some of the things. And as we talked about before too, I believe you can, a lot of times I'll ask patients, are their clothes fitting looser,
Mm.
or are they having to decrease the size, their pant size or their dress size? And so those are some other just practical ways that patients can assess their progress over time. I actually had a patient last week who has not been seeing much change on the scale, but she has been doing a really great job with her physical activity. She's actually exercising more than 150 minutes a
Mm.
week. She's optimizing her nutrition as much as possible, but she has told me several times that she's just not seeing much improvement on the scale. And so I took a step back and I said, well, let's look at your waist circumference, because again, we measure the waist circumference every time they come in. And when I looked at her waist circumference, it had actually decreased by several inches over the
Mm.
last several months that we have been following her. And so I told her that, and she was really excited about knowing that she has made some changes in terms of her waist circumference. But we can look at other parameters too. Again, we are talking about some of the chronic complications that can arise from obesity, such as blood pressure and diabetes. A lot of times patients will see improvements in those numbers as they are starting to exercise. And so again, I tell them, well, if you're not, don't worry if you're not seeing much of a change right now, because more patients exercise and the more diet, the weight will adjustments to their physical activity or to their nutrition to try to get to the goals that we have set for them. But we will start seeing improvements in their blood pressure, in their blood sugar numbers, in their A1C levels, their cholesterol levels. And so those are just some other things that we can look at. Another thing I'll mention, when patients start exercising and eating healthier, even sleeping better, they start feeling better in general. So again, if you don't see that number moving a whole lot, if you are feeling better, if you are, even your cognition, your thinking is better, you're more alert, those are just some other parameters that we can look at to say that, yes, we are making some progress in your overall health. And the weight on the scale, it will eventually catch up. You will eventually start seeing those numbers drop as well, because sometimes it can take time to see the weight decrease. But if we're seeing some improvements in those other measures, then I think that's really important as well, and what we should also focus on.
And I think that's sometimes one of those things that people forget, because I even talk to my patients about that as well, because I have a lot of people that come in and they're on some medication for something, diabetes, blood pressure, whatever. And they're like, do I have to be on this ever? And I say,
Right.
I don't know. Change level and gets lower. Then I say, well, then one of the things that we can consider and what we should do, we may start being able to taper off of that medicine. So like you said, weight is not the only thing that we should look at. This is not working. I'm putting all this energy in and it's not helping. But there are a lot of other things that you will be able to see and feel that says, okay, I'm going in the right direction and I should keep this up. But although people are doing that, they're dieting, they're exercising, they're seeing some of those changes. But at a point, we have to be realistic, because we know that this is what happens. Because again, obesity is a disease and not always due to like poor lifestyle things and stuff like that. And we talked a little bit more about some of the common causes of obesity in part one. But we have to think about, okay, at some point, their treatment. And there are different ways that they can, and there's like different medications. Can you talk to us about some of the different medication options that people may need? Now, they've optimized all the things, they've done all of that, and we're still not getting where we need to be. So what are some other ways that they can have some help?
Right. Well, you're right. There are a few medications that are actually FDA approved for treating obesity and helping patients to lose weight. And whenever we look at whether someone meets criteria in terms of needing a medication, as you mentioned, we do want to make sure they are optimizing their diet and their physical activity and even other behavioral modifications. But we also look at their BMI and other comorbid conditions. So in general, medications for weight loss are generally reserved for patients that have a BMI of 27 or greater plus a comorbidity. So one of those comorbid conditions like hypertension, diabetes, heart disease, sleep apnea, if they have one of those or more plus a BMI of 27 or greater, then that's an indication for a medication for weight loss. Or if they have a BMI of 30 or greater with or without a comorbid condition, then they are also meet criteria for a medication. And so again, as I mentioned, there are a few medications, and people may have heard of.
Dr. Bibb, I hate to interrupt you, but I want for you to say that seriously, like one more time, because I have some people who come in and they haven't reached that 27 and above. And but they're like, oh, but I'm overweight. I don't like the way I look, whatever it is, and I need treatment. But let them know, again, guidelines, if we're truly
Yes.
practicing according to the guidelines, tell them one
Yes.
more time, when does guidelines say that it is appropriate for us to go ahead and add some medication to this?
For
Go
medication,
ahead.
right, and as you mentioned, so a lot of the things, well, I try to say things that are based on guidelines that are evidence-based, and that's how we practice. Now, of course, I know that there may be some people that don't do that, but I know you and I both try to practice evidence-based medicine, and so we do follow the guidelines. So for the guidelines for a weight loss medication, that would be for someone that has a comorbid condition, as we mentioned, plus a BMI of 27 or greater. Or if you have a BMI of 30 or greater with or without a comorbid condition, then that is also an indication for a weight loss medication. And in addition to that, in terms of the guidelines and following the guidelines, sometimes insurance may not cover medications if patients don't meet the criteria for these medications. And so that's another reason why it is important to make sure patients meet criteria. But I guess I will say in general, a lot of times insurance really does not cover a lot of the weight loss medications, just in general. But I will say that there are some savings programs that are available for some of the medications. And so that's something that can be discussed with the provider to see if there's a savings program available. But just to kind of give you an overview of some of the medications that are available. So one is called Adipex. And I guess I'll say the brand name and the generic name, because sometimes people may know of them by the generic name. So the generic name for Adipex is phentermine. And that is one very common medication that we have that's available, that a lot of people, I think, get prescribed for weight loss. And as I'm going through, I'll kind of mention some of the side effects that can be associated and some of the concerns that need to be looked at in terms of whether someone is a good candidate for that medication. So Adipex can affect blood pressure and heart rate. It can also cause palpitations or make someone feel nervous or anxious, and even affect one's sleep. And so those are some things to consider when prescribing or if someone is asking for Adipex. And so if you have uncontrolled high blood pressure, then Adipex would not be a good option for you. Another medication is called Qsymia. So Qsymia is actually a combination medication with phentermine plus another medication called topiramate. And because it has phentermine in it, it can also cause some of those same side effects, but it can also cause numbness, tingling, even affect someone's cognitive ability. And so those are just some concerns there. Contrave is another medication that's actually a combination. It's a combination of two medicines called naltrexone and bupropion. You may have heard of Wellbutrin, which is the same thing as bupropion. And so that's a component of Contrave. And some of just the common side effects include nausea. It can also elevate the blood pressure as well, may even cause headache, dizziness, dry mouth. And then some people may have heard of the medication that's over the counter called Ally. The generic name for that is Orlistat. And then there is a prescription form of Ally called Xenical. And some of the more common side effects with this one include oily stools or abdominal pain, diarrhea, bloating. It also decreases the intake of fat-soluble vitamins. And so someone who's on that medication has to definitely take a multivitamin. And so that's a complication or a side effect that can occur with those two medications. And then we get into some of the newer medications. We have Saxenda and Wegovy. These are both in the same class. And Wegovy is actually the newest medication that we have available for treating obesity. Saxenda and Wegovy are both injections. Saxenda is a once daily injection, whereas Wegovy is a once a week injection. And some of the side effects that can be caused by these medications are GI side effects in particular, such as nausea, vomiting, diarrhea, abdominal pain. It also decreases the appetite, which is how it causes the weight loss. But those are the main medications that are specifically FDA approved for weight loss. Now, I do know that there are some other medications that definitely have weight loss effect. And so we have to think about those as well. So for instance, like metformin, when we're treating patients that have prediabetes or diabetes, metformin is generally the first line treatment for that. And it can actually have a weight loss effect, especially when we max it out to the max dose if patients can tolerate it. But metformin does have weight loss effects as well.
And with those medications, because I'm hearing a lot of different side effects, again, they don't always affect everyone, but it's something that people need to be aware of. But what is about the average amount of weight loss that people will have from that? Are they going to lose like 60 pounds, 80 pounds? And are they going to do it in like a month? Like, what is about the average amount that they may lose on some of these medicines?
Well, and it varies from one medication to another. It also varies from one individual to another. It also, and I will say that when we are prescribing medications, in order to have the most benefit in terms of weight loss, all of the medications must be combined with eating a healthy diet and exercising. And so even when we look at the weight loss, the average weight loss for some of these medications, it can be a wide range because all of those things must be taken into account when we are assessing whether patients are losing appropriately with these medications and how much weight patients can lose. And so it really can vary. I've had people to lose. I think recently had someone in the past, they've lost at least 20 to 30 pounds with Atipex. And again, it kind of depends over what period of time that is. And so there's really not one just simple answer for how much weight can be lost with one particular medicine, because it can be due to a lot of other factors and there can be a range. So it can vary. I will say, just in a row, Ally and Xenical in the studies have shown the least amount of weight loss. And I will say that what we're seeing with these newer medications like the Wegovy, they are showing some significant weight loss. And so, and the other thing with the Wegovy and the Saxenda, because they're in the same class as some of the medications for diabetes, they can have a dual effect in terms of helping to improve the diabetes aspect if patients have diabetes. And so we can see that improvement as well. And so I guess in general, I'll say that, we have seen, and I've seen in practice, some good success with Wegovy, Qsemia, and even Atipex. Again, because, and I'll say this too, Atipex is a medication that can be taken for a short-term period of time, generally about 3 months. But the other medications can be taken over a longer period of time, not really a specific time frame, but they are indicated for more long-term use, whereas Atipex is the one medication that's for short-term use.
Thank you for that clarification. Now, you have snuck in Wegovy, but I don't think people know exactly what Wegovy is, because I told the people we were talking about Ozempic today. And they tuned in because they want to know about Ozempic, because everybody and their mama is talking about Ozempic. So I don't know who Wegovy is. And I want you to introduce Wegovy and tell us who this is, because everybody knows about Ozempic. So tell us kind of the relationship between Ozempic and Wegovy.
Okay, well, that is a very good question, because as you have stated, Ozempic is the hot topic right now. We've seen it in the news. We've seen celebrities getting Ozempic, and we have seen people losing a lot of weight with Ozempic. And so I'll just start with Ozempic before I get to Wegovy, because we had Ozempic before we had Wegovy. And Ozempic is in a class of medications that is used to treat diabetes. The class is called GLP-1 agonist. This particular class has been shown to have some significant benefits and helps patients in terms of treating diabetes. But one of the other added benefits for this particular class is the weight loss effect. The other advantage of Ozempic is that it's only taken once a week. Now, again, this is an injection. There is a counterpart to Ozempic that's an oral medication called Rybelsus. So people may have heard of Rybelsus. So it's actually the same medication, which the generic name is semaglutide. And that's what Rybelsus is, which is the oral medication, and Ozempic, which is the injection. But Ozempic is specifically indicated for the treatment of type 2 diabetes. That's what it's been FDA approved for. And even when patients are trying to get it in terms of insurance coverage, the first thing their insurance is going to look at is, do they have a history of diabetes? Mm-hmm. And most of the time they will look to see whether they have tried other medications before they have we've tried to give them Ozempic. So that's Ozempic. But then Wegovy is really the same medication. Again, it's semaglutide, but it is in a higher dose compared to the Ozempic. And so that's one of the main differences. It's just the dose of it and how it's marketed and branded. But it's really the same. They have the same effect in terms of weight loss effect and the other indication, or the other things that it can help in terms of decreasing the appetite. They can have the same side effect profile, but the Wegovy is specifically indicated and FDA approved for treating obesity and the management of weight loss or weight management. And so that's kind of the difference between the two. Ozempic is specifically for type 2 diabetes. Again, it has the same weight loss effect, but the Wegovy is specifically FDA approved for obesity and weight management. Does that explain?
No, absolutely. That definitely explains it. It's like you said, that they are at their core essentially the same medicine. The dosing is different, so they call them different things. And
Right.
so then they are marketed differently. But everybody knows about Ozempic, and that's the big thing that has, kind of gotten the more exposure. But Wegovy is technically the one that people are out there seeking. So I just wanted to clear that up, because I know everybody is like Ozempic, 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 but to know really which one that they are looking for and understand the criteria of what is going to be able to be approved. Right. And we talked about these oral medications, but at some point, surgery comes into play. You and I both know and have either referred patients to bariatric surgery, have had patients to say, hey, I'm considering or interested in bariatric surgery. Talk to me about that. Like, when is it at a point where patients truly do qualify for that? And what does that process from your standpoint look like?
Right. So again, very good question. And bariatric surgery in general should be considered for patients who have failed losing weight with some of the lifestyle interventions that we have tried to recommend in trying to achieve the appropriate BMI. Now, it is also based on criteria. And so patients have to meet certain criteria in order to qualify for bariatric surgery. And that's also based on the BMI. And so bariatric surgery is indicated for patients that have a BMI of 35 or greater with a comorbidity. So some of those obesity related comorbid conditions that we've discussed, plus a BMI of 35 or greater, or if they have a BMI of 40 or greater with or without a comorbid condition, then those patients would be indicated for bariatric surgery. And so that's kind of the parameters that we use. But of course, there is a longer process that the patients have to go through. They generally have to be evaluated by a nutritionist, by a psychologist, and get other studies done before being fully cleared. And then, as I mentioned before, the lifestyle modifications are very important, and patients have to show that they have attempted and are still working on trying to make lifestyle modifications while they are in the process for being worked up for the bariatric surgery process. And so it's, again, very important that they still focus on the lifestyle modifications, but those are the main things that we look at in terms of the criteria that patients have to meet for bariatric surgery.
And the other thing that we had discussed with that, with doing the surgery, so they get to the point and they say, okay, I want to do surgery, but
Mhm.
it comes down to cost, because this is not a cheap situation that is going to happen, and you're going to have to invest into it financially. And what we've seen is people are going out of the country to
Yes.
have these procedures. Tell me what you have seen and how you advise your patients who are considering going out of the country because they say, "Oh, I just want to, kind of save some money." And
Mhm.
it seems like it's the same procedure. It should be fine. It's not that big a
Mhm.
deal, and I'm just going to go over there and do it.
Right, right. And as you mentioned, I realize that it definitely is probably cheaper than getting it done here in the States. But thinking about the costs that you may have in the long run and the complications that can arise after having surgery. And so that is definitely something that I advise against patients doing in terms of going out of the country to have bariatric surgery. I do highly recommend that they find someone here if they are considering having surgery, and we can help them with that process. We can look at their insurance and see if their insurance will cover the surgery, because there are some insurances that will
Mm.
cover bariatric surgery. Even you may consider seeing if the weight loss center has a weight loss, or I'm sorry, a payment plan that can be done to help with the cost of that. And so those are some things to consider. But I definitely have seen patients that have gone out of the country and have had some complications, whether it's a complication from the surgery itself or possibly from them not getting the proper nutrition that they need, because of course
Mm.
we know that the dietary factors are going to change after they have surgery. And so there are different requirements that they must have in terms of their vitamins and minerals and just nutrition in
Mhm.
general. And all of that needs to have close follow-up and close monitoring by the bariatric surgeon, even the family medicine physician, and even the nutritionist that's following along after surgery. And so I have definitely seen some various cases of patients having complications following surgery. And two, when patients have surgery outside of the country, then and they have a complication and they need to be evaluated or seen by someone here, then it's very difficult to find someone that will accept that patient, because a lot of times surgeons do not want to treat patients that have had surgery elsewhere, especially outside of the country. And so those are just some things to really consider if someone is thinking about having surgery outside of the country, thinking about the things that can happen after the surgery,
Mhm.
but and then the follow-up that is necessary, because really patients need to be followed up pretty closely within a month, and then after that every few months, and then on at least on a yearly basis at some point after they've had the surgery. But especially within that first year and those first several months after having surgery, then that's a really critical period in terms of patients being monitored. And it's really hard to get back to Mexico after they've had surgery to have that follow up.
Those are great points because this is not something that we are theorizing about and we're like, oh, maybe this will happen. No, we have seen it. And once a patient has a complication, they can be serious because, like she says,
Mhm.
you are not taking in the nutrients like you typically would. So certain things can happen. There's just a lot of things that you want to consider if this is something that you say, I meet the criteria, but I want to know how I can do it. You have to do your due diligence, you have to do your research, and then figure out what is going to make the most sense because this really is a serious surgery. And you
Mhm.
want to make sure that you are in good hands when it happens. And then what is the follow up going to look like? Who's going to be there if I have questions or concerns or this doesn't make sense? So make sure that you do your due diligence and your research when trying to find someone. So, Dr. Bibb, like I am so full because I don't know if I should say full because we're talking about diet and exercise. But this has been such a great discussion. We've talked about all the things to kind of give people a good jump start and to get back on track if they've fallen off from their New Year's resolutions, all of that. They're just trying to get the healthy lifestyles and they need other options. And how can I do it and make it make sense? But did you have any other like comments or tips that you wanted to provide so that they can continue on their journey?
Sure. I would just like to just say in closing, I know we've talked about a lot, and as we've mentioned, obesity is due and can be due to a lot of different multiple causes. And when we think about the treatment, we should think about the treatment being an approach that requires multiple components,
Mhm.
including, as we've talked about, eating a healthy diet, having appropriate physical activity, even your sleep should be optimal. So, all of those things are very important. But in closing, I would also just like to say that when we think about our goals for our nutrition and our physical activity, I would recommend setting goals in terms of the SMART format. So we may
Mm.
have heard of the SMART goals, which is an acronym for setting goals. And so I'll just kind of review real quickly what SMART stands for. So the S is for specific. So just want to describe exactly what you want to achieve in terms of your weight loss goals. And then M is for measurable. So have a specific way to measure your progress. And A is for attainable. Make sure that your goal is realistic and that you have the necessary tools and resources to meet your goal. And then R is for relevant. So make sure that it aligns with your interests. So we talked about interests, your preferences. Make sure it aligns with what you enjoy doing and your overall long-term goals. And then finally, T is for time bound. So make sure you specify the time, the duration, and even the frequency of your physical activity. And even so, just one quick example, say we want exercising more. So instead of just having a general goal of saying we want to increase our exercise, we can set a SMART goal and say, for instance, I plan to start walking on the treadmill. So we want to be specific and we want to set a
Mhm.
time and a duration. So we want to walk on the treadmill for 30 minutes at a specific time. Say, for instance, when we get off work at 6 o'clock. And then how many days a week? So we want to do 3 days a week, but let's be more specific. And we'll say we want to do it Monday, Wednesday, and Friday. And then we'll say we're going to do this at least for the next 4 weeks. And once we've achieved that goal, then we can set a new goal and try to continually increase our physical activity, improve our nutrition. So, in general, we can overall improve our health and we can all be smart and we can be healthy. So, those are my final comments. And again, thank you, Dr. Booth, for having me today. And I appreciate the discussion. And I hope this was very helpful for someone today. So, thank you very much.
I know that it was helpful. Thank you again for joining us because you guys know that I have good people on when they mention things and they don't even know that I've probably already mentioned it. And so one of the things that I talked about was SMART goals. That was one of the things that I was talking about in January to get us back on track, or make sure that we stay on track when we're trying to reach and attain the things that we want to do it, and how we're going to be able to do it. And so I created a whole little template and sheet for you guys. So I'll link that again so that you can match it with this and do it with your exercise, do it with your diet. And like she said, start off with something that's realistic and attainable at that moment, and then go back and revise it. You always want to revise your SMART goals, and then you say, okay, I've done that, I've achieved that, now this is what I want to do, and how you can build on it and add it. So thanks for adding that information to us. We're having some people that are chiming in and said, thank you so much for watching. So they're saying that we're providing some great information for them. And I want to say thank you to Mrs. Forrest Wilder for tuning in and staying with us to the duration of this, because I know it was a lot. And so I appreciate everyone's time and for joining us. And I'm definitely going to make sure that the replay gets out there, because these are a lot of actionable, attainable things that people can realistically put in place and say, this is where I'm going to go, this is how I'm going to do it, so that we can all be healthy. Because, at the end of the day, I want for you to be well. So thank you guys so much for tuning in. Also, you want to make sure that you subscribe and turn on your notification bell, because then every time we have new content, it will let you know when we're doing it and when we're going live, because I don't want you to miss out. And also share it so other people can be aware, because again, this is not just for us to keep it to ourselves. We want other people to be well so they can live their best lives too. So make sure that you get it out there, because sharing is caring. And until next time, I will see you guys soon. Take care.